Hello everyone, this is Dan Bort from Texas PTS here in San Marcos, Texas. I'm going to take a second to talk to you about my case. A woman I evaluated last week, 33-year-old female with upper back and shoulder pain. So I'm sure you're already aware of all these facts here, the patient profile and so forth. So like I said, my patient was a 33-year-old female, customer service supervisor. Big thing, she had a C5, C6 disc removal recently. You can check out the photo scores at the bottom. Okay, and you should have had a chance to look at this already. Nothing too crazy here, just some pain on the medial border of the left scapula. Okay, so take a pause and answer some of these questions in Moodle, and then when you're ready, watch the video. Okay, so here are the aggravating factors and easing factors. So for P1, extending the head, pain is anywhere from 2 to 10 out of 10, which eases after 15 minutes. The patient also felt like the pain came on randomly, and especially whenever she felt tense in her shoulders, neck and upper back. So to ease her pain, she would just mentally calm herself down. And for P2, the aggravating factors, she couldn't really recall any. It was kind of just random as well there. And so her finger numbness didn't really bother her very much anyways. So I didn't go into detail on that. Okay. As far as the patient history goes, she's pretty normal. She's getting some good sleep at night. She's had these symptoms for about a month. So she's had these similar symptoms before she had her disc replacement, but it seems to be worse now than it was before. The patient said that her symptoms are getting better, and she hasn't had any other treatment other than coming to see us and seeing her doctor. Okay, the patient's pretty good. Not much in the way of comorbidities, red flags, yellow flags. The only medication she's on is naproxen and Flexerol. Okay, another timeout. So go ahead and take a look at these questions and develop some answers, and then keep going with the video. All right. So as far as the physical exam goes, some precautions. Obviously, the big one, the patient just had neck surgery. So when I was looking at her, I noticed that she had a couple posture issues. Her left scapula would wing, and her right shoulder was forward. So for functional movement analysis asterisk signs, I chose neck extension pain rating, and neck flexion range of motion. For screening the patient, I just used the upper quarter screen, pretty much everything that's in there, to kind of clear out the elbows, shoulders, and cervical spine. And for the neuro exam, she had normal myotomes, normal reflexes, diminished sensation in right C6 and C7 dermatomes, and the patient also had bilateral finger numbness with the ULTTA, but no reproduction of back pain. So here are her cervical range of motion, active range of motion numbers. As you can see, she's kind of limited, especially on her left side, rotating to the right, and right side bend, you can tell that she's a little tight. So here's some muscle length findings. So on her left side, she's tight, like I said, and I reproduced her back pain symptoms. She had tight pec minor on her right side, and she had some muscle weakness in her upper back, pretty significant actually. And along with that, she had weak deep neck flexors. So with palpation to to her T2 and T5 spinous processes using CPAs. She had some pain, reproduction of symptoms. I also wanted to look at her shoulder, her left one specifically, so I did Hawkins-Kennedy, painful arc, and along with the obviously the active range of motion, passive range of motion, and she had negative tests for those special tests. She also had some poor upward rotation with her left scapula. I noticed that, and like I said, right pec minor major tightness, some forward shoulder on that right side. Okay, this one more time out. So at this point, I'd like you to just think about what your primary hypothesis might be following the exam. What should we use as an objective asterisk? Okay, and questions. So I look forward to talking to you guys on Thursday. Have a good week.